Hello, and welcome to today's Lunch and Learn presentation, Advanced Care Planning, Making Your Wishes Known. I'm Dr. Steve Reinches, President and CEO of North Kansas City Hospital and Meritas Health. Thank you for joining us. Advanced care planning means that making certain healthcare decisions are made ahead of time. These decisions reflect the type of healthcare you want if you become unable to choose for yourself. When you decide for yourself, it relieves your family of the responsibility and the stress of choosing for you. Of course, it is recommended that you share your preferences with your family and healthcare providers. Today's speaker is Dr. Alexander Gamble. Dr. Gamble is a palliative care physician with Meritas Health. He will talk today about advancing planning and how to get started. Dr. Gamble is a board certified in psychiatry, internal medicine, as well as hospice and palliative care. He earned his medical degree from St. Louis University School of Medicine. He completed his residency at the University of Iowa Hospitals and Clinics and his fellowship at the University of Kansas. Please join me in welcoming Dr. Gamble.
Well, thank you very much, Dr. Reinches, and thank you all for joining us and taking the time today to spend a little bit of time learning more about advanced care planning, what it is, and why it's important. As Dr. Reinches said, I work here at North Kansas City Hospital with our wonderful inpatient palliative care team. As part of our work helping patients and families facing serious illness, a lot of what we're working toward is making sure we're always hearing our patients' voices. In some cases, people aren't able to raise their voice for themselves, and so we're really relying on others to help us hear their voice, and very often important documents like advanced care planning. So hopefully today we'll make a clear case for why it's so important to take the time ahead of a crisis to make sure that our wishes are known, understood, and can be followed, as well as what these documents do and how they can help us with that process. So thank you all for taking this time. So my objectives for our talk today are to first, again, describe the importance of advanced care planning, undertaking this process and in a timely fashion. We're going to talk specifically about a pair of documents. The first is the Durable Power of Attorney for Healthcare, which we'll refer to as a DPOA, and the other is an Advanced Directive or Living Will. We'll also be talking about the relationship between these documents, so why they're important and how they work and how they can work for you to help make sure that your voice is always heard and that you're able as best you can to direct your healthcare no matter what kinds of issues might arise. So first, what is advanced care planning? Well, as Dr. Ryan just mentioned, this is the process of making your wishes for future healthcare known. This process is appropriate for anyone over the age of 18. So very often folks may think, well, I'm healthy, I don't have a lot of health problems. Is this really something that I need to do? What I often would give as examples for why this is so important for anyone to undertake these documents, creating these documents and working with this process are really accidents. So I myself am young and fairly healthy, but I can always get in a car crash unexpectedly. I could slip in the shower tomorrow morning and suddenly be in a situation where important decisions have to be made for my health care, and I'm not able to make those decisions for myself. Certainly, it's also possible that sudden, unexpected, and very serious health issues can arise. And I think the pandemic has really underscored that for a lot of folks, that our circumstances can change very suddenly. Important decisions might have to be made. And it's really helpful to have taken the time beforehand to think about and communicate our wishes, particularly if we'd be in such a circumstance. So advanced care planning is really a process that's appropriate for anyone. It's even more appropriate for people living with serious illnesses. And when we think about it, it makes sense. Folks who are living with heart failure, with cancer, or advanced lung disease, really any lifelong serious illness is going to have issues that arise unexpectedly, exacerbations of those illness or other complications related to them. And so it's even more important that we've taken time to think about the situations that might arise and to communicate our preferences if those things should come up for us. So again, advanced care planning is for everyone. Let's think about a particular document. Now, the first one we'll often talk with our patients and their families about is the Durable Power of Attorney for Healthcare. Again, we'll sometimes shorthand this as DPOA. The Durable Power of Attorney for Healthcare is a form that lets us formally designate who would make decisions for us with respect to our healthcare if we're not able to make them for ourselves. Now, for anybody who's listening or tuned in from Missouri, this is especially important. Missouri is one of a handful of states where there are no formal laws in place governing who makes decisions on your behalf if you can't make them for yourself. So functionally, that means that your spouse, if you're married, doesn't have a greater right to make decisions for you than an estranged cousin that you haven't seen in 10 years. That might sound kind of silly, but we know that even inside of a closer family group, there may be disagreements or discrepancies in what everyone thinks your preferences might be. And so again, navigating that space can be really difficult. The law doesn't give us much guidance. Most healthcare institutions have kind of an in-house process for trying to determine who the appropriate proxy is. But the easiest way to prevent these kinds of challenges is just to go ahead and formally designate by use of the power of attorney for healthcare who you'd want to speak on your behalf. Now, one question I often hear from patients or a concern where folks are reluctant to complete these documents is that they're worried that this is going to take away their ability to make their own decisions. And so one thing that's very important to understand is that the power of attorney for healthcare is only activated in the case that you can't make your own decisions. Typically, these forms will have specific language governing this process of activation. And usually that'll say something like, when two physicians have determined that I am not capacitated, that is, I no longer have the ability to make decisions for my own healthcare, then this person who I have designated is to speak on my behalf. Again, that's typically going to be reviewed. It may be, again, if I suffer a head trauma, in the initial period, I may not be able to make my own decisions, but as I recover and may regain consciousness, if I can make my own decisions again, then that power and authority comes back to me. So this is really only active in the case that I can't make decisions for myself, typically as assessed by my healthcare providers. Anyone can be designated, and we can usually also place alternates on this form. And it's good to have alternates. Again, the future can be uncertain. If the person I've asked to be called upon to speak on my behalf is for some reason unable to do so, it's good to know who else do you entrust to speak on your behalf. Some folks will want their surrogates to work in tandem. So they may appoint multiple people and say, I really want, for example, my kids to work together. I think they all have some sense of what I would want, but I want them working together to make that decision. Importantly, your surrogate doesn't have to sign on these forms. We have occasionally met with folks who've been called on to act as a surrogate who are not aware that they were named as a surrogate. So it's not a requirement that they're aware. They don't have to sign on this form. So if they're somewhere far away, but you want them to be called on the phone, that's okay. But it is important that they're going to be aware of that. And we'll talk about why. So again, anyone can be appointed as a power of attorney for healthcare, but there's a couple considerations we think are really important in considering who we're going to ask and whether or not they're appropriate to serve in this role for you. The first is, does this individual know what I would want? Now, this can be a complicated question that can seem fairly simple, but when we consider that there's a lot of different situations that can arise, and it can be hard to predict or anticipate them, particularly if we don't have firsthand experience with serious illness. If we've not faced the kinds of decisions that get made, particularly when people have more serious or advancing illness, it can be hard for us to imagine that. So that first piece is, have we thought about the kinds of things that would arise? I think some situations are easier to imagine. Again, if I was in a car wreck, if I suffered a severe head trauma where I wasn't going to be able to wake up or was expected to be in a persistent coma. But say I face something like cancer, have I thought through the kinds of decisions that might come up in that setting, in that space? More importantly, have I talked about my preferences in those situations? Have I communicated to the person I'm asking to be my healthcare proxy what I would or wouldn't want, or how I would think about making decisions, especially difficult decisions? And then lastly, have I checked to see if they really understand? Communication can be really challenging, and especially in topics and conversations that can be pretty emotional. So really having a robust conversation is so important to ensuring, does this person know what my wishes are? And do they feel like they would be able to follow through on them, which is our other consideration. Is this someone that I can count on to follow through on my wishes? In discussing these considerations with patients, I'll sometimes hear things like, well, all my kids know what I'd want because we went through this with their aunt last fall. And I've been very clear about my wishes. But I know my son is pretty emotional. And in a difficult situation where he was having to make those kinds of decisions on my behalf, I'm not sure if he'd be able to follow through my wishes, even though I know he knows them. whereas my daughter's really solid, and I think even if she disagreed with my preferences, I know I could count on her to follow through. In that case, we really advise people not to put their son in a situation that they don't feel confident that he could fulfill. These conversations, these decisions can be difficult, they can be emotional. And so I think taking that extra time to ask that further question, not just, do you understand what I want? Do you feel confident and comfortable to make sure my voice is heard? But also, do you feel comfortable to serve in that role? Again, taking the time to do this before these situations arise gives us the opportunity to identify other individuals who may be better suited to serve in this role for us. Again, thinking about these conversations can sometimes be difficult or uncomfortable, and that's understandable. These are difficult situations to imagine, can be hard conversations to have. The other thing I would encourage folks to think about is that having these conversations is really a gift, not only to yourself to make sure that your wishes are always understood and that your preferences are followed in making decisions for your healthcare, but also to your family. Having these hard conversations with families who are being called upon to speak on their loved one's behalf, it's always easier, even as hard as it's going to be, when they can reflect on conversations they've had in the past. When we meet with families who can say, I know exactly what my dad or my brother or my mom would want because she told me, it goes a lot easier for them. There's also been studies that have shown that people who are called upon to act as surrogates to make decisions on someone's behalf for healthcare are at higher risk for anxiety, depression, or even PTSD when they're not familiar with their wishes. And so it's really a gift, both for yourself to make sure your voice is heard and to your family to ease that work for them, to make sure they really know and can speak confidently on your behalf. The other form I want us to think about today or talk about is the advance directive or living will. Now, this is a really different document that serves in a different role, but is equally important to that power of attorney for healthcare. What this form does is it allows for the expression of patients' preferences under very specific circumstance. And I really want to hammer on this point because this is where I find the most confusion when we communicate with patients and families about these documents, what they do and what they don't do. The history, I think, is helpful, and the history of this form actually comes out of a case in Missouri that went to the Supreme Court. The outcome of that case was the court determining that people absolutely have a right to determine their preferences for life-prolonging treatment in the case they're in a terminal or unrecoverable condition, but it has to be clearly documented. And that's really what gave rise to the creation of this form, the advance directive or living will. So the language we look at here on the slide is from the Missouri Bar's Advance Directive. This is a form that's available for free online. And what it says is, if I am persistently unconscious, or there is no reasonable expectation of my recovery from a seriously incapacitating or terminal illness or condition. And so these are the terms under which this form is activated. Typically, it requires two physicians to make this determination. But what's important to understand is that, strictly speaking, the advance directive does not come into play. That is, it does not direct your treatment unless this determination has been made. Now, the structure of what comes after that language can vary. In some forms, there's checkboxes where it just goes through a list of specific treatments. You can say, if I reach a point where I'm not going to be able to get better, I do or do not want these things done to try to keep my body alive, to prolong my life at that point in time. It may cover things like radiation therapy, chemotherapy, artificial nutrition and hydration, things like attempts at resuscitation or CPR in the case that my heart would stop beating. Other documents, often the newer ones, are looking more at questions of general function or quality of life considerations. So rather than being a checkbox list, it's a little bit more of a narrative, thinking about how do I think about these kinds of questions. What this really gets down to is trying to better understand your goals for your healthcare and how and at what time they may shift or change, and what considerations may go into that change. In general, the clinical utility of this document, that is, how useful is this for actual decision making, may be limited. And that's especially true with these checkbox forms, because often the circumstances we find ourselves in with our patients are not so black and white. It's not really cut and dried as to whether someone is going to be able to recover. That is, that initial determination of unrecoverability can be hard. And so very often we're having conversations where there is some potential for recovery, but we may not be able to get fully back to where we were before. And so often these documents that get more into how do you think about your preferences for care? What is an acceptable quality of life in your estimation can be much more helpful for guiding decision making where the situation is a bit grayer or a little bit fuzzier. And so I want to try to connect the dots between these two tools and show how they relate and kind of what the differences are between them. So again, first we have that power of attorney for healthcare, which allows us to designate who would speak on our behalf if we can't make our own decisions, if we can't raise our own voice for ourselves. And that form is only activated in the case that you're incapacitated, that is, not able to make those decisions and speak on your own behalf. It's a form that's appropriate for anyone over the age of 18, knowing that anyone can be in such a circumstance to have decisions made where they can't speak for themselves. And the advance directive expresses our preferences for care, but is only activated where we're determined to be in that unrecoverable or terminal condition. Again, understanding that this form is for anyone over the age of 18, as anyone can be in this situation. These forms are meant to complement each other. The point of both forms is to make sure that no matter what happens in your healthcare, your voice will always be heard. So in the case that you would be in a terminal or unrecoverable state, the advance directive gives direction in what kinds of treatments should or should not be used according to your desires to try to keep you alive or keep your body going longer than that. Whereas the power of attorney lets you designate specifically who you want to speak on your behalf to help make decisions as you would make them, in the case that you're not able to make them for yourself. The other value, I think, in completing the advance directive is, again, as we said before, it can be difficult for people to imagine what kinds of decisions may arise if they're in a difficult medical situation. And so sometimes the content of that form can help us focus that conversation to think about what kinds of choices might come up and let you think through and talk about with your proxy your thought process. In many situations, what we find is it's the content of that conversation that really helps direct that surrogate decision maker. They can think back and reflect on what was most important to you. How did you think about what is an acceptable quality of life? We find people have a huge variance in what they think about as acceptable. Some people have very high standards. I've met with patients who said, if I can't live on my own, in my own house, doing the New York Times crossword puzzle every day, anything less than that is unacceptable to me. And I wouldn't want a lot of medical stuff done to try to prolong me if I'm not going to be able to get back there. Other folks have a lot simpler ideas in mind. I've met with people who said, if I can watch a Chiefs game and eat a bowl of chocolate ice cream, that's good enough for me. I don't care if I'm not at home, if my family has to come see me, that's fine. And so really understanding, how do you think about what's most important to you? And as your health needs change, how might that change your preferences for what you are or are not willing to undergo to try to get more time? And most importantly, at what point might you want your care to focus entirely on your comfort and the quality of your life? So having had an opportunity to think about that process, those kinds of questions, what sorts of things may arise, to reflect on and share with your family or whoever may be called on to speak on your behalf, is a huge gift and benefit if they'd be in that situation, to think about your thought process. What's important to you and what do you put first and foremost in your decision making? Ultimately, the situations we're in and having to make decisions in may be more gray. It may not be that clear circumstance that activates that advance directive. And so in that case, we're really looking to your power of attorney to help fill in those gaps. Again, that's where more robust conversations are so helpful, where your power of attorney for healthcare can reflect on those conversations and try to help us put the pieces together to make sure the care we're providing you is always consistent with your wishes. That's our most important goal. Whether or not we do any specific treatment often isn't so much a medical question as it is a personal values question. What is it that you're hoping that we'll be able to achieve? If we think we're going to be able to do that, then treatments moving in that direction are appropriate. If not, then we may need to reassess the goal and come up with a new plan to sort through what your subsequent goals might be. If I want you to take home any points, it would be these. The first is that advanced care planning is for everyone. There's not anyone in our community or any other who can't benefit from having these conversations. to make sure that your healthcare providers are always talking to the right people, the ones that you've advised and that you trust to speak on your behalf. And that if you'd be in a situation where we're not going to be able to get you better, that terminal or unrecoverable condition, that we know exactly what you would or would not want done at that point in time. It's never too early to start these conversations. As the pandemic has shown us time and again, our health can change rapidly and unexpectedly. Having had an opportunity to think about who we trust to speak on our behalf, to make sure they're educated and that they feel comfortable to serve in that role is essential. And lastly, this is all a process. Advanced care planning is a process. Our preferences for care will change as our health circumstances, as our understandings change, as we go through situations with our family members, our loved ones, and start to see some of these situations for ourselves. That might change the way that we feel about these treatments, these procedures, the kinds of things we would be okay with or want to prohibit for our care going forward. And so we should keep these conversations going. Keep talking to the people that we may ask to speak on our behalf about what our wishes are and how we think about these things. Make sure that the forms are updated as appropriate. Sometimes our family structures change. We may want to ask different people to serve in these roles. Sometimes our relationships may change. We may decide someone may be better suited to speak on our behalf. And especially where our preferences for our care may change, we want to be sure that those advanced directives are also updated appropriately and that everybody's aware and familiar with them. And then as one bonus tip, this is one I'll pass on. This is not my own genius, but a great tip that I got from a wonderful patient a long time ago. When you've completed these documents, you've had them notarized and finalized to where you want them, keep copies of them in the glove boxes of your vehicles. We meet with a lot of families when we ask about these forms to make sure we have all the pieces on the table. We'll often hear, well, we completed that with our attorney and it's living in a safe with the rest of our important financial instruments. That's a good safe place for it, but it doesn't do us a lot of good when we're trying to make sure we're hearing your voice and understanding your wishes. If we keep copies of these in the glove box, those cars are liable to turn up in the space where we need them for decision making. These forms typically don't have important identity theft information. They're not going to have my social security number. They typically just have names and phone numbers, exactly what we want to make sure we reach the right people, to make sure we're hearing your voice all the time. So that's the content of my presentation for today. I really want to thank everybody again for taking this time. I hope that it's been helpful. I hope we've got a better understanding about advanced care planning, that process, and look forward to taking any questions that anyone has.
Thank you very much, Dr. Gamble. We do have a few questions, and I do want to say that's a great tip. Before my current job, I was a neurosurgeon, and there were so many times where someone would come into the emergency room in a comatose state, and the families would say that they do have an advance directive or a durable power of attorney. And I would ask, do you have that with you, or do you know what it says? And the family members would have a blank look on their face and they wouldn't know how to find it at a time when really critical decisions needed to be made. So I'd like to start with a couple of questions that we have. First is, what do you do as a palliative care physician when somebody comes in and has an unrecoverable condition in the ICU, but they haven't filled out a durable power of attorney or an advanced care directive? So just walk through the situation of someone who is critically ill, who hasn't filled out the documentation that you outlined today.
Yeah, that's a great question, and unfortunately a circumstance that does come up more often than we'd like. I think our first steps in that process are trying to identify anybody that we can that's affiliated with that patient. So for folks that have been receiving ongoing health care at North Kansas City Hospital, we're often looking back in their record to see who else has been involved in their care in the past. Can we identify, is there a spouse? Are there other close family members, adult children? Or really anybody who knows this patient, to help us figure out what is the landscape of their social support so that we can try to find out and identify. It may be that we simply don't have those documents on record, but as you said, they may exist elsewhere. And so we're reaching out to the folks that hopefully know that patient well to identify, has that been completed and we don't have it? In truly the case where they don't exist, then our next step is to try to query among the people we're able to identify and find out who seems to be most familiar with our patient's wish. And I think that's the most important piece, is really framing that question clearly. Very often our surrogates express distress. They feel like they're making decisions about someone's healthcare, or that they're going to decide what the outcome is going to be. The question we're always trying to clarify is that we want to hear the patient's wishes. So if it's someone's brother, we want you to help us think about what your brother would want in this circumstance. And that's really what the power of attorney for healthcare is meant to accomplish, is identifying the person that the patient felt comfortable serving in that role. When that hasn't been formally designated, we're looking for the person closest to that patient who's most familiar with their wishes. Ultimately, if we don't have these documents, our goal remains to hear our patient's voice as clearly as possible. In the interim, especially when folks are seriously ill, we're erring on the side of caution. We're typically going to use every treatment available to help that person stay alive and recover, assuming that that's their primary goal. Knowing that as time goes on, folks' goals may shift and change as our understanding about their situation and the expectations for their healthcare and their potential recovery may shift and change. That's where we're trying to find out, what are their preferences? Where might they establish boundaries? Or where might they say, if this is my situation, I want you to focus on different care goals. And that's the part we really need other folks to help guide us with. In the rare case that we're not able to identify anyone who's familiar with our patient or their wishes to direct us, that's where we're often involving the state and looking for appointment of a guardian, really a state appointed individual to speak on that patient's behalf and help determine good decision making. So it's really a thoughtful process where we're always first and foremost trying to prioritize the voice and preferences of that individual patient that we're seeing. But it's a lot harder when they haven't formally designated that person or had those conversations.
So let's take the example of someone who does have a durable power of attorney or a living will. Should those documents be shared with my primary care doctor, for example?
Absolutely, that's a great question. So what we'll recommend to folks, once they've got these forms completed, have that copy in the glove box, make sure that everyone who's in my circle is aware that they exist, but then definitely to share them with care providers. And I appreciate you bringing that question forward. That's another good tip I could add to these slides. So yes, anywhere I receive healthcare, making sure that they have a copy on file. Primary care office is a great one. If there's hospitals I'm routinely going to for care, making sure they have that on file as well. We will at times reach out to primary care offices. Again, if the some families we meet with say, I know we did that form, but I don't know where it is. That's where we'll then kind of get to work and look. And the primary care office is a great place where we can sometimes turn up those forms. So always good to have anyone that's involved in our healthcare aware that these forms exist and hopefully having copies for their records as well.
So here's another question from the audience. Let's say that I'm in good health and I fill out these forms, the durable power of attorney and the advanced directive. And I, 5 years later, come down with a terminal illness such as cancer, and I'm in the hospital. Can I change my forms while I'm in the hospital?
Absolutely. And so again, when we say advanced care planning is a process, that's a really good example of what we mean. As my health needs change, my preferences for care are also likely to change. And so making sure these forms are up to date, that they do reflect my current wishes, and that they're appropriately updated as time goes on. Again, the documents never override your wishes. They should always be a reflection of it. And so in the case of someone's preferences change, if they're thinking about things in a different way, we always want them to go ahead and update those forms. Make sure that our family, make sure that our healthcare proxies are aware that that update's been made. They may have copies of the old form. We're going to want to replace and update those as well. So absolutely, anytime we have a healthcare status change, we should go back and review those documents and think about, given where I am now, does this still reflect my wishes, or do we need to update this somehow to better match where I am right now with my goals of care and what I'm wanting my healthcare providers to focus on.
Okay, here's one final question from the audience. When I go to the driver's license bureau, I sign at the bottom saying that would like to be an organ donor. How does that signature differ from the DPOA or the living will?
That's a great and a really important question. So the signature on the driver's license is about our preference for organ donation. Typically, this is only going to take effect. So as we said, the advanced directive only takes effect when that determination about being in a terminal or unrecoverable condition has been established. Organ donation is for people who've been determined that they have died. So typically folks that have met criteria for brain death as example. In those cases, again, we're not looking for guidance on what's to be done next because that signature represents that guidance, that this individual has indicated that if something would occur that caused me to die, this is what my preference is for organ donation. And so typically in those cases, the organ donation network is going to be offering education, letting their family know that this is their preference while they move forward in making that ultimate gift. And that's such an important question. We're often seeing folks with serious, potentially life-limiting illness who are waiting on organs. So having really clear conversations and making people's preferences known for that is so crucial in making sure that they don't miss an opportunity to make that gift if that's something that they want. And so that's the way that system is structured, is to make sure that for our patients, if they would be in that circumstance, if they would suffer brain death, that they're able to make that gift and that wish is honored and followed. And so that's how that process is structured.
Well, thank you very much, Dr. Gamble. This is such an important discussion for us to take into our own lives in our own homes. We certainly want to thank the audience for joining us today. We hope you learned why advanced care planning is so important and how to get started. You can find more information about advanced directives at nkch.org/AD. That webpage also has a Caring Conversations booklet with forms available for download. We really appreciate your participation today, Dr. Gamble, on the information that you shared with the audience. Thank you very much and have a good afternoon.